I'm very sad to have to inform you that there are 6 further Victorians who have passed away.
These are very challenging numbers.
The figures are very concerning.
Our view of this virus is actually very narrow. Everything we know is based on the number of people who've been tested. But that's not the whole picture. There are many people who are infected but missed. They're known as undocumented cases, meaning they have very mild symptoms or none at all, and don't come forward for care or a test.
It's sort of like this, in the wintertime, if you get the sniffles, if you get a little bit of chills or a slight sore throat, you don't go to see a doctor and you don't stay home from work or school. You still go about your normal routine. And as a consequence of that, you're spreading the virus out in the community. You're taking it on public transportation, you're taking it to the workplace, to schools. That's what allows these viruses to persist and get around, it seems.
There's some debate about how many people truly have no symptoms or just very mild ones. The key point is that if infected people aren't picked up for whatever reason, there could be many more cases out there than we're aware of.
This dividing line between asymptomatic and symptomatic is not always that clear, but the dividing line between documented and undocumented is quite clear. And if the majority of the infections for a particular respiratory virus are undocumented, it gives it a lot of opportunity to spread unknowingly.
Jeffrey Shaman applied that to the outbreak in China to see what the true level of infection was likely to have been. And he found that 86% of all infections went undocumented. And through the sheer weight of numbers, they passed the virus on to a lot of people.
Because there were so many more of those undocumented infections, even though that they were less contagious per person, they were responsible for the lion's share of transmission of the virus.
But how reliable is that finding? Some of the best evidence comes from the enclosed environment of cruise ships like the Diamond Princess, where they were able to track people very accurately. And a third of infected people had no symptoms.
For every case that you find, you should multiply it by 5 to 10 probably, maybe 12, maybe 15, to get the total number of infections that have actually taken place.
Okay, let's bring this home. There are hundreds of cases a day in Victoria with a pretty good level of testing. From what Dr. Shaman knows about this virus, what does he think could be the true number in Victoria?
I would say you're more towards the lower end. You're probably more like 1 in 5 persons is being documented as opposed to 1 in 10, let's say. I would think the multiplier would be a little lower.
We pride ourselves on very high levels of testing, so we would expect perhaps a lower level of undetection in Australia than some overseas settings. The speculation has been 1 or 2 additional cases for every detected case.
We'll soon know the answer. Researchers are reanalyzing blood samples taken for other reasons to look for antibodies. That will tell them how many undocumented cases there are in Australia.
It's very important to know not just how much we're missing, but where we're missing cases and whether it's in certain age groups or certain postcodes or certain local areas. The serological findings will give us an insight into how we need to enhance our testing strategies to better get coverage of the cases in the community.
The implications of this undocumented spread are enormous for all Australians. We can't let down our guard.
The majority of people manifest with what appears to be mild symptoms or no symptoms, and they're undocumented, yet they're still contagious. And this supports this silent or stealth transmission. Even though the majority of infections are mild or asymptomatic, there's still this fat tail where enough people are having severe reactions to this and winding up in the hospital and dying from it, that it poses a really grave threat in which it's going to kill millions of people worldwide. You put that together and you're looking at the biggest acute infection threat we've faced since 1918.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.